MorristownGreen.com.
I'm with Dr. April Wazeka, who is a pediatric pulmonologist at the Morristown Medical Center. She's an expert on asthma. First of all, how prevalent is asthma in children today?
It's about 10 to 12% of children nationwide, and some centers, like urban centers, it can be as high as 30 to 40%. It's very common.
And is it becoming more prevalent over time?
Yeah, over the last 20 years, we've seen an increase of about 30 to 40%, and we're not exactly sure why that is, but we've seen that in all age groups.
So I grew up a long time ago with asthma, and in the schools I suffered quite a bit. It was pretty miserable. What, if anything, has changed in terms of medications and in terms of procedures in schools?
Medications have improved dramatically. Inhaled steroids, which are medicines that stop inflammation in the lung and help control asthma on a daily basis, have gotten better and better. They were not available even 30 years ago, and those are one of the mainstays of our therapy now. The other thing that has improved is the use of oral steroids, such as prednisone, when children are having an asthma attack. That helps prevent them from being in the hospital. So it's very rare nowadays to hospitalize children for asthma, whereas in the past it was very common. In schools, there's different things that are in place. Most schools have an asthma action plan that parents can fill out, so that if the child has an asthma episode at school, they have their inhalers available, and the nurse and the teacher are aware of what the child needs when they're having an episode. There's also things that have been done to decrease triggers at school, such as smoke, for instance, from school buses, making schools a smoke-free zone. Many schools do not have air conditioning, but the ones that do, we work to have the children with asthma in the air-conditioned classroom. So different things are being done to control triggers at school.
Some of the common triggers would be what?
The most common trigger in younger children is viral illnesses such as colds. Most kids get 7 to 10 colds a year when they're under 5, so that's a very common trigger. Other triggers you might see in a school setting would be allergens such as dust or mold, weather such as very cold weather, very hot weather, changes in weather, smoke or strong fragrances can trigger it. Stress and anxiety can also be a trigger, and then obviously exercise is a very, very common trigger. About 90% of kids with asthma will have some type of symptoms with exercise.
Should kids with asthma play sports?
Absolutely. The main thing I tell parents is that they need to make sure that their child's asthma is well controlled on a daily basis, and then they need to take what's called a rescue inhaler or a short-acting inhaler 15 to 20 minutes before they do sports. But it's very important for their general health to exercise.
What about cockroaches and asthma?
Cockroaches definitely are a big allergic trigger, so if a child is allergic to cockroaches, that could be an issue. Unfortunately, they're everywhere. They're more common in high-density urban areas, apartment buildings. So it's difficult to eradicate them completely. If I have a child with a severe cockroach allergy and they're in a home setting where cockroaches are prevalent, obviously you try to eliminate the cockroaches with the help of your exterminator, but also that child may need some type of allergy medication. And educating the parents about how to prevent roaches from coming into the home is also helpful.
Are there any genetic therapies coming that would eliminate asthma?
Not to my knowledge. What is interesting on the genetic front, though, is there's a lot of research on genetic differences in response to asthma therapies. So, for instance, certain types of asthmatics may respond to one medication, certain types of asthmatics may respond to other medications, and certain patients with certain genes may have bad reactions to medications because of specific mutations. But as far as I know, there's no cure on the horizon from a genetic standpoint.
Do we think it's largely a genetic or an environmental condition?
It's both, but the large majority of patients with asthma, over 2/3, have some type of genetic predisposition. By that I mean a family history of asthma, allergies, and what's called eczema or dry skin. That's called atopy, those three things. So in the family, there's a genetic sensitivity, and we can actually map it to specific chromosomes. So with that genetic tendency, then if there are environmental issues, such as if they're allergic to dust and there's a lot of dust around, they'll have it, they'll have a trigger for their asthma.
What percentage of people outgrow their asthma?
I don't know an exact number, but a very large percentage will improve with time. We always tell people with asthma it's a chronic condition, so it comes and goes, but it may not go away 100%. However, that being said, most children as they reach teenage years, young adulthood, most likely would not need a controlled medication, but they still might need a rescue inhaler from time to time.
Dr. April Wazeka, I know you have a bit of a cold yourself. Thanks for talking with us.
Thank you very much.
Morristown Green.com